Chapter 57: Skin Disorders. Pruritus is itching. It's actually a symptom rather than a disease, but it's very common with skin disorders, so that's why we're talking about it. What are causes and risk factors? It may be triggered by touch, temperature changes, emotional stress, chemical, mechanical, and electrical stimuli, and may be enhanced by stress, anxiety, and fear. So, how do we actually manage pruritus? We can use those emollients, those chemicals that actually help to calm down the itching. Skin lubricants too, because sometimes the skin just gets really dry and that's what's causing the itching. Corticosteroids, antihistamine, and some local anesthetics. Nursing care is that we educate the patient and we enforce the treatment. The atopic dermatitis or eczema comes or has three stages: the acute, subacute, and the chronic stage. For the acute, it starts with the red and oozing crusty rash and has that intense pruritus or the itching. Then, after the acute stage, it might go into subacute, which is going to be redness, excoriations, scaling plaques, pustules, and then there might even be those silvery appearance. And after that, it will go into a chronic stage where the skin will become dry, thickened, scaly, and even brownish gray color. What are causes and risk factors? It actually comes most of the time with a history of asthma, hay fever, and some food allergies, right? Could cause eczema. Or those patients that has an immune dysfunction, then they put them at risk factors, at high risk for this. Medical diagnosis, by the looks of it, we do physical exam. We can see those acute, subacute, and chronic physical appearance of the lesion. And then we do actually skin biopsy and check, rule out other things so that we can actually diagnose that this is an eczema. And then if it's caused by those allergies, then we can do those serum IgE levels. If it's elevated, then it's actually an allergic reaction or an allergic eczema. Medical treatment, we give them some corticosteroids, anti-inflammatory. We want to keep the skin moist, antihistamines, and sometimes if it gets really bad, then we give them the immunosuppressant tacrolimus or um, pimecrolimus. Nursing care is we identify the contributing factors, like what is causing it. For example, is it a food allergy? So then we try to prevent it from, exacerbating. And then we recommend those open weave fabrics and loose clothing for comfort. If allergy is suspected as a cause of a dermatitis, the doctor or provider may perform allergy tests to identify the allergens. Then some other things that we can do is we can do like soaks, right? We can soak the skin, do occlusive dressing, and those emollients that we did talk about to keep the skin moist. Contact dermatitis is an inflammatory condition that is caused by contact with a substance that actually triggers an allergic response. So, for example, a patient that is allergic to dust, right? Then they get exposed to that substance and it triggered an allergic response. We call it contact dermatitis. Seborrheic dermatitis is a chronic inflammatory disease of the skin, usually affects the scalp, the eyebrows, eyelids, lips, ears, sternal area, the axilla, umbilicus, groin, gluteal crease, and area under the breast. What is the cause and risk factors? Cause is unknown. However, they believe that it's aggravated by emotional stress and some neurologic diseases. The diagnosis is physically looking at it and seeing those lesions that we see in those areas that we did talk about, like your scalp, eyebrows, and eyelids. Medical treatment, ketoconazole or your nicerol is effective for this one, or selenium sulfide, your Selsun, tar, zinc, salicylic acid, or resorcin. Some topical corticosteroids actually can help too. Nursing care, this is not caused by a poor hygiene. So we want to actually educate the patient that it's not because you have poor hygiene, right? This is a chronic inflammatory disease of the skin that is usually caused by triggered by a risk factors like your stress and some diseases. Okay. All right, psoriasis is an autoimmune disorder that is characterized by abnormal proliferation of the skin cells. And because of that rapid proliferation of the epidermal cells, that's when it actually manifests like this bright red lesions that is covered with silvery scales. In page 116, look at that, how bad that is. Figure 57.2, that is a picture of the psoriasis. Cause and risk factors, those people that are genetically predisposed, put them at high risk to develop psoriasis. And some factors that may aggravate is stress, strep infections, alcohol, drugs like ACE inhibitors, beta blockers, and lithium antimalarials. Some drugs actually can cause psoriasis. Medical diagnosis, again, by looking at it physically, and looking at those bright red lesions that is covered with silvery scales. Medical treatment, we give them topical corticosteroids, tazarotene, ester, Delvonex, some topical medications, anthralin to remove the heavy scales, and then we also give them methotrexate. However, please remember that methotrexate is contraindicated with pregnancy, and those patients that's taking methotrexate need to check liver testing periodically and blood studies because of the adverse effects. And then when we're doing the topical therapy, we actually give them or have them like go to the sunlight for like ultraviolet therapy because it enhances the topical therapy effectiveness. Nursing care, we gotta make sure that we're taking care of the altered self-concept and educating the patient and the people around them that the condition is not contagious. Okay, condition is not contagious. Even though this looks very, very uncomfortable, this condition is not contagious. Entertrigo is the inflammation of the skin where the two skin surfaces usually touch. Cause and risk factors is the friction, right, and the constant moisture, and then the heat. And most of the time, this is called by the Candida albicans, which is the yeast. Medical diagnosis and treatment, we give them topical corticosteroids and an antifungal because it could help with the inflammation. Wash with water and pat dry. And we can even put like a soft gauze in there to kind of like help with the moisture. Okay, keep the area clean and dry. That's the goal for intertrigo. And intertrigo is also fairly common among patients in long-term care facilities. And common sites of this are like your under the breast, the folds under the belly, the abdomen, or like in the armpits, right, in the axilla, in the neck, back of the neck. Okay, those are the common sites of intertrigo where there's like a friction or moisture, constant moisture from two skin surfaces. Okay, fungal infections. So we're talking about your tinea pedis. It really depends on the location of the fungal infection, and that's when we call it. Tinea pedis is for Atlas foot. Tinea manus is in the hand. Tinea crus is in the groin. Tinea capitis is in the scalp. Tinea corporis is in the body. Tinea barbrae is beard, and candidiasis is could be in the genitals. Um, direct contact or inanimate object. Okay. The lay term ringworm is sometimes used to describe the circular lesions of this fungal infection. Causes and risk factors. Pregnant people vary at a high risk for fungal infection because of their decreased immune system. Those malnourished patient, immunosuppressed patient, those that are taking antibiotics and oral contraceptives, and then those diabetes. So if you look at this whole picture, you could see the risk factors is actually boiling into those people that have a suppressed immune system, right? Medical diagnosis from looking at it, like physical examination, or from skin scraping. Look at that picture in 1119, figure 57.3. It's very red, it's very beefy, right? Medical treatment. Wet compresses can help, and the what we call keratolytics, what they do is they soften those scales with this some tinea infections. And for some patients also, clotrimazole is actually helpful. More medical treatment, so we give them the antifungal powders and creams, right? Like your nystatin. We can give nystatin for the patient. We give lotrimine, clotrimazole, very common, nystatin, mouthwash or lozenges, or we can give them oral amphotericin B, topical ACOLES, your clotrimosoles, miconazoles, or oral fluconazole, your diflucam. And amphotericin B is an intravenous that we give for the patient, usually pre-treated with antihistamine and non-opioid analgesic to reduce the risk of chills, fever, and headache. And then for the adverse effects, like the shaking, chills, we can give the medication or we can give the patient the medication dantrolene when we're giving the amphotericin B to kind of like help prevent those adverse effects. Acne is a skin condition that affects the hair follicles and the sebaceous glands. The pathophysiology of acne is when those androgenic hormones they are being secreted that causes the increased sebum production. Sebum are those oil glands, right? And bacteria proliferate, causing those follicles to become blocked and then inflamed. This can be triggered by birth control pills, again, hormonal, right? Oil-based cosmetics, high doses of systemic corticosteroids, and hormonal changes with menstrual period and some endocrine disorder. And that's why if you actually think about it, those acne have those exacerbation during the times when there's like hormonal changes, like menstrual period or during puberty, right? medical diagnosis, physical examination, and then medical treatment. We can give them those topical antimicrobials or retinoids, and those very severe um, acne exacerbations. We can even give them oral antibiotics, your tetracycline, azithromycin, erythromycin, and we can give them some hormones therapy like your estrogen therapy. Spironolactone also can help. And then your Accutane is the medication that we give. So let's look at that pharmacology pharmacology capsule in page 1120 about Accutane. Accutane can cause mental depression, possibly leading to suicidal ideation. Should depression develop, contact the physician immediately to have the drug discontinued. Depression should resolve once the drug is stopped. Should depression continue, the person should be referred for additional counseling. The parents and the child should be taught the signs and symptoms of depression to report immediately to a parent or healthcare provider. Herpes simplex, just a little review that this virus can be transmitted by direct contact. So you have herpes zoster. This is commonly called shingles, right? And it's caused by the varicella zoster virus. How do we diagnose this? We do the Zank test or the viral culture test. We culture it and we check that it's actually positive for the herpes zoster virus or varicella zoster virus. The lesions for herpes zoster typically last approximately for 2 weeks. Okay, and then it's painful. We call it, neuralgia, and this is treated with a variety of like analgesics, those medications that could actually help for pain. Anticonvulsant drug and antidepressant also helps to kind of like calm down the neuralgia. Medical treatment, we give them antivirals, your acyclovir, famciclovir, valacyclovir, or foscarnet, either PO by mouth or IV. Okay, this is effective if initiated within 72 hours from the onset of the virus. Then we can also do what we call a soaking dressing, like wet dressings with this boro solution. What we want is to actually loosen those crusts, because after the initial manifestation of the herpes, which with the blistery like lesions, is gonna start being crusty. So once it gets to that point, we can use those wet dressings. We soak it in boro solution to loosen the crust. And then we give them topical antibiotic after the crust is formed. Necrotizing fasciitis. This is a very serious infection of the deep facial structures under the skin. This necrotizing fasciitis is caused by aerobic and anaerobic organisms, mostly from the Streptococcus, Staphylococcus, Peptostreptococcus, bacteroides, and Clostridium species. This is what we call the flesh-eating bacteria. What happens is that those organisms, they excrete those enzymes and they destroy the blood vessels that supply the area, and that area is deprived of the blood flow, then necrosis occurs. Okay, treatment involves extensive debridement. We have to remove those dead tissues, because if we don't, it's not going to heal, right? We have to remove those necrotic tissues, and then we give them intensive um, IV antibiotics, intravenous antibiotics, and topical antibiotics. And when if we had to remove a lot of those dead tissues, then eventually maybe the patient will need skin grafting. Very important to remember what with the necrotizing fasciitis, this infection progresses rapidly, very fast, okay, with the loss of large amounts of tissue. And if it's not treated, it can even result in death, okay? So very, very serious infection. All right, and then if you go to page 1124 in table 57.1 and 57.2, read through those other infections, other common infections. One thing that I would like to point out though is the cellulitis. Because cellulitis, we see this very common, okay? Usually this is caused by Streptococcus pyogenes. There is a local tenderness and redness, and then if it remains untreated, then it will become systemic. It will cause malaise, chills, and fever. And then the site itself is gonna look very erythematous, very red, with like vesicles that will form. Vesicles may rupture, and it will be weeping. Okay, so what do we give usually for cellulitis is we give them penicillin, a cephalosporin, or vancomycin. Okay, infestations on the skin, we have the lice and then the scabies. So for lice, there will be manifestation, there will be itching, right, of the hairy areas, and then you will actually see those nits or those eggs. And how do we treat this? We actually give the patient what we call pediculicide, like shampoo or lotion. It actually kills those lice. And then after that, we have to wash the clothing and bed linens in hot water, or usually we'll need to treat all the members of the household. Okay. For scabies, this one is you're gonna see manifestations like rashes with this thin red lines on the skin, okay, red lines on skin, and there will be itching too. Treatment is we give them those topical scabicide. We call it scabicide, those chemicals that could actually kill those scabies. And then we do that, and then we apply this cavicide lotion or ointment, and then we wash it, and then after 1 week we repeat it. Okay, repeated 1 week later. After that, we gotta make sure also that the clothing and the bed linens are washed in hot water. Okay. Okay, pemphigus is a chronic autoimmune condition that has those blisters that develop on the neck, the face, back, chest, groin, and the umbilicus. The blisters will rupture and it will release those foul smelling drainage. So how do we actually manage? We give them those baths, those potassium permanganate baths, Domeboro solution. Sometimes also those oatmeal products will suit the affected areas and will also reduce the odor and then decrease the risk of infection. In addition to that, we can give them corticosteroids and other topical or oral antibiotics. And the patient with extensive skin loss will require the same care as a burn patient. Now we have cancer. So those actinic keratosis, let me see, in page 1125, that letter A picture, that is actinic keratosis. Okay, that is a pre-malignant lesions. Okay, this is a cancerous lesion. And then we have non-melanoma skin cancer. You have the basal cell carcinoma and squamous cell carcinoma. Basal cell carcinoma is benign, painless, nodular, pearly appearance. They grow slowly and rarely metastasize. This is usually seen in sun-exposed area. It's also in page 1125, letter B. That's basal cell carcinoma. Letter C is your squamous cell carcinoma, and this one is usually in the sun exposed area in the lip and oral cavity, and then most associated with overuse of tobacco and alcohol. They grow rapidly and then they metastasize. And then you have the malignant melanoma. It's that picture in letter in page same page 1125 letter D. And malignant melanoma is the most serious form of serous cancer because it can be fatal if actually it metastasizes in the other parts of the body. Melanomas can be found anywhere in the body, not just on the sun exposed area. They have irregular borders and uneven coloration. A lot of them are very dark, but some are light in color, and they usually begin as a tan macule that enlarges. So look at that picture in that page. Um, what we do is we remove this malignant melanoma surgically, and then the area around the melanoma is also excised. If that's not also working, we will put it in combination with chemotherapy and immunotherapy. Then we have the cutaneous T-cell lymphoma, which is characterized by the migration of the malignant T-cell to the skin. This cutaneous T-cell lymphoma usually starts with what a rashes that looks like an eczema, and then it's gonna be those macular lesions that appears on areas that are protected from the sun. Even they will form a tumor, they become big, they enlarge, and then they can spread into distant sites. Kaposi sarcoma is a malignancy of the blood vessel. Okay, this is manifested by red, blue, or purple macules accompanied by pain, itching, and swelling. The lesions appear first on the legs and then on the upper body, face, and the mouth, and then they become enlarged to form those large plaques that may drain. Okay, Kaposi sarcoma usually seen in patients with HIV, human immunodeficiency virus infection, but it can also be seen in some other diseases. Local lesions, we can probably excise it, cut it and inject it with some chemotherapy. But systemic lesions are treated with chemotherapy, immunotherapy, and radiotherapy. Okay, just the summary that we just talked about. Melanoma can be found anywhere in the body, not just in the sun exposed area, right? And the most serious form of skin cancer. Cutaneous T-cell carcinoma is characterized by the migration of the malignant T cells, and Kaposi sarcoma is manifested by those red, blue, and purple macule. Then we have some disorders of the nails, those infections like your ingrown nail, and then you're gonna see manifestations would be there will be like pus, right, and redness and swelling and pain in the area. And what we do is we make sure that the area is clean, right? And if it gets too bad, then we give them those topical antibiotics, or we can even give them PO antibiotic if needed. Okay, for burns, there will be classification based on the size and the depth of the tissue injury. Partial thickness and full thickness. So partial thickness are called first degree and second degree burns. This burn affects only the epidermis, right? It's called superficial or first degree. If the epidermis and the dermis is actually affected, then we call it superficial or deep partial thickness second degree burn, depending on the tissues that is affected. Those burns that extends into even the deeper tissue layers, they are called full thickness, or we even degree it to third degree or fourth degree burns. If you look at that picture in 1129, right? Figure 57.11, that's the burn classification by depth. If you see, it's very clear. First degree, second degree, which is partial thickness. Third degree is full, and fourth degree is full thickness, reaching the muscle or the bone. Okay, burn size. So the burn size may be estimated using what we call the rule of nines. Okay, the rule of nines is in page 1127, figure 57.9. That is the estimation of the percentage of the body surface area that is burned. What we do is we give them those percentage, right? And then we actually totaled to estimate the burn size. So for example, the book gave us an example. In an adult, if one arm and hand are burned, then the burn size is estimated as 9.5, because you can see it in that number over there. Okay, and then medical treatment. So we have to make sure we're taking care of ABC for the burn patient. Airway, breathing, circulation, very important. Especially, so you start with the airway, right? Make sure that the airway is clear, patient is able to breathe, and is not suffering from those inhalation of the smoke. Right, and then we give them oxygen if needed. Circulation, there's like imbalance of the fluid balance, right? The shift of the plasma proteins from the capillaries and out into the bloodstream, that will cause like those imbalance. So we gotta make sure that we're taking care of fluid resuscitation. Very important during the first 24 to 48 hours. And while we're doing fluid resuscitation, we're actually checking the intake and output of the patient to monitor them, to prevent them from shock. Okay. Okay, after that, then we're gonna take care of the wound care, right? Wound care, usually what we give is the silver sulfadiazine or silvadine, and sometimes we would even use the sulfamylon. This is very effective with treating the wound for burns, because this silver sulfadiazine is actually like an anti bacterial also, so it really is effective when we're taking care of wounds from burns. In addition to all of those things that we do for the burns, we also got to take care of the prevention of infection. Remember, the first line of defense for the immune system is your skin and mucous membranes. So with the burns, the skin is actually damaged, so there's a high risk for infection for these patients. So make sure we are actually preventing the infection, doing hand washing, hand hygiene when we're taking care of the patient, making sure that we're monitoring them closely for signs of infection. For the stages of the burns, so we have the emergent, here let me point it, emergent, acute, and rehabilitation. Emergent stage begins with the injury and ends when the fluid shifts have been stabilized. The acute stage begins with the fluid stabilization, and the rehabilitation stage follows the acute stage and lasts as long as efforts continue to promote improvement of adjustment. Physical appearance is a component of body image and may affect the self-esteem of a person. So it's important for us nurses to not judge the patient's motivation for seeking surgery, like plastic surgery. If they want that aesthetic surgery or reconstructive surgery, then we actually need to support those patients because it's good for their self-esteem. Nursing care, though, for plastic surgery still applies your pre-operative and then the post-operative, making sure that we're doing what we're supposed to be doing, just like in a regular surgery.